Minister, you and I and other colleagues here in the House have shared time on the COVID committee, and unlike other deputies here tonight, I'm not interested in what happened last weekend. I'm interested in where we go from here and the go-forward strategy. And I think, without going back over where we were, COVID committee was very important, and I'm personally sorry to see it finish without some platform for the whole interpretation and interrogation of COVID strategy going forward. I know it might be taken over by the Health Committee, but I think we were doing a pretty good job. But in terms of that, I think one of the things that has come out of all of the learning is that testing and tracing is key to where we are at the moment. And with respect to that, maybe I'll give you a synopsis where I think we are at the minute. I was just looking at some data earlier this evening in terms of the R number, and I think Dublin is probably about 1.2, the country is about 1.5. And on that basis, that means that disease will double within 2 weeks, within 14 days essentially. So we know testing and tracing is the key, and we can individually test based on symptoms, which is what we're presently doing. We could screen test based on the indices, but we would need more capacity. We cannot continue to do either without adequate testing capacity or tracing resources if the disease keeps on rising. NPHET have persevered with PCR testing only. They have refused to look at LAMP testing. They have refused to look at antigen testing, despite it being used in first world countries everywhere else. Our border is open. Our air travel access remains unrestricted. Our ICU capacity is fast diminishing. And yet we also have the deferment of other diagnostic procedures in breast, cervical cancer. And even in my own hospital, University Hospital Waterford, which I highlighted to you already, just one isolation room for the cardiac capacity, which you have kicked that question onto the HSE, which they have not bothered to answer to me yet. And on top of this, we have numerous business sectors which are themselves in ICU territory, Minister, and cannot continue to endure an on-again, off-again business. And the Taoiseach is suggesting potentially a circuit breaker protocol for the country, which will be a national lockdown. So can I ask you the following questions, Minister? What is the government plan or NPHET plan to deliver screen testing or asymptomatic targeting as a strategic move to isolate disease clusters and individuals? That's one. I brought antigen test information to NPHET 13 weeks ago, which all efforts and all evidence shows could seriously augment and assist our national testing capacity. Why has this testing not been considered or used? Why has NPHET not decided to consider LAMP testing, which is now in use in Germany, in France and Italy? And will you now, Minister, commit to provide a pathway for outside medical opinion leaders to engage with NPHET on a regular basis regarding the ongoing modelling and testing that they are approving? And secondly, will you provide a platform for private industry to engage with NPHET to look at the possible rollout of new technologies and to ensure a structured platform is developed to ensure follow-up analysis is communicated by NPHET to these industry leads, if you please?
Thank you very much, Deputy Shanahan. So just the OR number, the latest figure I have, the latest update from the Chief Medical Officer tonight is it's 1.2 for the country. So it has now the cases are continuing to rise, but the OR number has come down. In terms of mass screening, or we call it serial testing. So there are several programs going on. So there's serial testing or mass testing in the nursing homes, in the meat processing industry, and in direct provision. The positivity rates are very low. The latest data for them is around 0.3% positivity, which is very positive, if you'll excuse the pun, because it means that obviously very few people have it, and it is catching cases. So staff who come in who are asymptomatic, they've no idea, it is catching them. Now, it's not catching everybody, nor can it, and obviously we have a very serious case in one nursing home which has been reported in the last 48 hours. In terms of antigen testing, I'm delighted to be able to provide some good news. So we asked HICWA to do a technology assessment on rapid testing technologies. That paper was considered by NPHET today. The Chief Medical Officer, the Deputy Chief Medical Officer, the Secretary General and I met early after the NPHET meeting, and we discussed exactly this. So where it's at now is the technology has to be, so NPHET's view is the technology has to be validated. And what they explained to me, they mean by that is we'll set up some pilots where we We run antigen testing parallel to PCR testing, which is seen as the gold standard. I believe HICWA and NEFIT and the HSE will work together to validate that. What I would like to see is very quickly a situation where it is validated and where our experts believe that there is a role for antigen testing here. Now, they informed me that we were discussing antigen testing used around the world. Their view or their understanding is while other countries are using it, they're not using it as their primary test. That PCR testing is still the way to go. But I'm delighted to be able to report that progress just as of today. Oh, and sorry, your other question, Deputy, was on the companies. So the companies don't engage with NEFIT. I'm not sure that that would be the appropriate engagement, but the companies do engage with the HSE. And I know the HSE is working with or engaging with companies in Ireland and abroad on various testing solutions.
I could just say, Minister, I think the companies should engage with NEFIT. This has been the problem. I think 13 weeks ago, and it will be proven, I'm quite sure, that antigen testing should have been augmented 13 weeks ago when I brought it to people in NEFIT. And the validation could have been done in all this time. We need it now. We need to get these things delivered, and we need people to be able to engage with thought leaders in NEFIT. They cannot be blind and they cannot be out of communication with other industry peers and medical peers in this country. We are all in it together. We need to use all our resources, Minister. Thank you.